lives.
Well, Dr. Malcolm Roth is the chief plastic surgeon at Albany Medical Center, and he's the former president of the American Society of Plastic Surgery. Dr. Roth, how unusual is this? What happened to April?
Unfortunately, we're hearing more and more stories like this. It's increasing in severity, frequency. I first want to thank April and again applaud your courage to be able to sit here in front of millions of people and tell your story. And Katie, thank you for doing the story, because as a practicing plastic surgeon, I'm seeing this more and more. Women who have not done their homework, they're going to people thinking a complication is something that happens to somebody else. That won't happen to me. And they're looking to save money. Financial times are tough. This is not the place to bargain shop, because you're going to get a lot more than you bargained for.
I understand this kind of augmentation really originated among members of the transgender community, that they were doing this by people who were not qualified to do this kind of procedure. They were getting very sick, and as April said, they were so full of shame and so embarrassed, they never got help for this.
Yes, it is fairly common in the transgender community. They have what's called pumping parties, and it's often mixed with alcohol. You go to a hotel room or somebody's garage. It's a bad combination. First of all, having a procedure not in a physician's office and mixing with alcohol, so your judgment is impaired. But they feel they have nowhere to go, and in the community, they know somebody, as April did, who said, I've had this done. And early on, you may think everything is fine, but it's a ticking time bomb. You don't know when the complications are going to start to happen.
You know, April wanted to have a curvier backside. Are there legitimate ways to achieve that?
Oh, sure, absolutely.
I've always tried to make my bottom smaller, personally. But to each his own, right? But whatever,
I get
April.
No, I get it.
but there are legitimate ways to do that?
Of course, but people should start their shopping for a board-certified plastic surgeon, and by going to plasticsurgery.org, you know that you're going to a board-certified plastic surgeon who's got 6 years of training to be a plastic surgeon, has passed written and oral examinations, and only does procedures in accredited facilities, which is also important.
Now, April, as I mentioned, you are training for